Case number one involves an 11-year-old obese child. She was seen for an ear infection and we took care of it, but I couldn't help but talk to her and her parents about the problem of her weight. This is a scale that measures up to 500 pounds, and we're getting more of these in the urgent care centers because there are people that are morbidly obese walking in. You can't use your standard scales, and this is becoming an epidemic in the United States because anytime you have any problems with obesity, as you'll see in my BMI video, you're going to have problems with high blood pressure, high cholesterol, and diabetes. So we're getting to almost 1 in 3. In some states, 1 in 2 people will have morbid obesity. The child's doctor is doing a blood test on an 11-year-old, which is necessary but painful, every 2 years. As the mom says, every 2 years to check for diabetes. And so far it's negative, and that's great, but I think they're losing focus. If they keep on waiting for the blood test before making a change, one of these days, one of these years, it's going to become positive. And then what do? Well, okay, at that point in time, then you get the dietitian, then you get the nutritionist, then you start exercising. At that point in time, she'll be a teenager, it'll be much harder. So the suggestion is, in this case, why even wait to the every 2-year mark? Why not just go ahead and educate on nutrition, get her involved in different forms of exercise at school to see and discover which she might like. See about learning to cook in the kitchen with mom. Mom loves to cook. Supposedly the kid doesn't really work in the kitchen with her, but if you make it a family endeavor, it might be fun. Bottom line is, don't wait until the disease comes, be proactive. And in the case of a young kid, I gotta tell you, it's always up to the parents and the examples the parents are setting. So even if there's no disease pattern, and unfortunately the mom was slightly overweight, even if there's no disease pattern, I would not wait. Everybody should be making the change. I mean, why just wait for the kid? Why not have the whole family change? Case 2 involves a 30-year-old male, previous runner, great athlete who was given a diagnosis of chest pain from anxiety. The diagnosis was carried on until finally he went to a cardiologist after several years and was found to have multiple vessel disease. He subsequently went on to get bypass surgery and is now 2 months post-surgical. He's now having symptoms of what sounds like a reactive depression. He is not able to return back into any activity just yet. He's trying to maintain a decent diet, but is essentially becoming frustrated with just maintaining bananas, rice, applesauce, and toast, and still having problems with cholesterol. So the reason I bring it up is because even after you get rescued with modern techniques of today, it doesn't mean that you're scot-free, you're going to live on to a healthy life. I now have a 30-year-old who still has an issue with cholesterol, hasn't been given any omega-3 fish oil, has been given very little nutritional information, and has been told to return back to work because he's good to go. I feel that he has a little bit of reactive depression. How would you feel if you're 30 years old and you had your chest cracked open and now you're walking like a 60-year-old? So I think he has that. I think he has to maximize on his nutrition. No one's even talked to him about how much fiber to take in a day. He was just given some handouts on the Mediterranean diet, and that's about it. So now, granted, some of the restrictions to education process are because of the limited time that we can spend as doctors, nutritionists, physical therapists, cardiac rehab specialists, but even then, I think it still puts the responsibility, unfortunately, on the patient to look into other possibilities of how to maximize on life. He hasn't been given any counseling. He hasn't been given any tools to develop a relaxation response. Still highly stressed, so I do believe that we can take advantage of going into the direction of relaxation therapy, better nutrition, watchful waiting, perhaps medicines or herbs like St. John's wort, omega-3 fish oil, magnesium, niacin, increasing just on fiber to 35 grams a day. All this, and then maintaining some form of really good sleep without the pain or dealing with the pain of the sternotomy. That, in addition to a slow rehab process over the course of several months, will give him probably a better outlook. So that's what I would have done, but I still have to hear from his cardiologist, and I think just coming up with a plan outside going back to work and trying to do as best as you can is giving the patient a little bit of insight that there is another life that can be better than how he's feeling 2 months post-CABG or post-bypass surgery. Case number 3, 55-year-old male, lawyer, owns his own practice, history of high blood pressure, history of high triglycerides, on a whole bunch of medicines, doesn't like seeing the doctor, doesn't like taking pills, but will do it anyway. Well, he was having problems with headache and expressive aphasia yesterday. Expressive aphasia is when you can't speak. You have an idea, but you can't speak it. And most of you know that usually means stroke. He should know that too, but he didn't want to do anything. I think what made him a little comfortable with the diagnosis was that he had the same thing about 10 years ago. That's when he was 45. I don't know how busy he was, but 45 is a little younger. He probably wasn't on as many medicines. Luckily, he was ruled out with a CAT scan of the brain and an ultrasound of the heart 10 years ago. The problem is, you have time that adds up. Usually it adds up damage, especially if you don't do anything healthy. He kind of just skirted by with his cholesterol lately. He's gaining weight. He's not exercising anymore. He's under a high stress position. He's very successful, but I am apprehensive to say that this time his workup will probably be positive. Just like the kid in case number 1, why wait until the disease is positive? If we know we've got symptoms, if we know the family history is positive, don't wait, just be proactive. Start the exercise, start the diet, start the nutritional changes in education. This gentleman is a little tough because he's, I guess you could say, stubborn. He's very well educated, but he's also under high stress. Because of the high stress, he probably hunts for processed food. Because of the processed food, he probably has an emotion that's flying and in need of fast response: alcohol, caffeine, adrenaline. So those things do work to get by, but you're going to pay for it eventually. And I'm hoping that he had his CT scan already. At least that's what I would have started with, and then the full workup later. Bottom line with this case is that his doctors probably did an okay job, but it was more on him. If he just refuses to do anything, fine. What I had suggested for the wife was to really be ready for when he says, white flag, I give up, give me ideas about how to make changes in life. Give me ideas about how to develop the relaxation response, take up yoga. Forget the old exercises from bodybuilding when you were 20 years old. That will not work when you're 55 and you work 50 hours a week. You gotta do something more condensed, you gotta do something more positive. Something where you don't have to go to a gym that's half an hour to an hour away, spend that much time. You want to condense it. And I think that if you work on flexibility or even walking in the woods, hiking, local forest preserve, as all I suggest in a lot of my other videos, you can get just as much of a benefit from lowering the blood pressure, lowering the epinephrine, increasing serotonin and oxytocin, and that'll help with getting rid of some of that cholesterol and decreasing the inflammatory response that's going on in the heart, or the brain in this case. I hope his CT scan was done. I hope it was negative, but this is the case where I believe that until the guy's ready, the wife will just have to kind of not condone his activities, but keep on gently reminding and get ready for either the worst case scenario, a stroke, and taking care of his butt, or the best case scenario where he says, I want to make a change, and at least if the wife has gone down the avenue of knowing who to call, knowing where the programs are in the local community, or knowing which coaches to go to first, it'll be easy as plugging him into the formula and getting him to make the changes to manifest some form of new lifestyle.